morning, good afternoon, good evening, depending where you are, and welcome to this first ever online award ceremony of the Health for All Film Festival organized by the World Health Organization. Bienvenue à tous et à toutes. Nous avons une traduction française en simultané sur le site web de l'OMS, www.int/film-festival. Y hay también una traducción al español en la misma dirección web del OMS. Okay, back to English. I hope you appreciated my French accent, which is maybe better than my English one, certainly, and let's not speak about my Spanish. So, this ceremony is dedicated to all champions of health. We launched end of October a call for films to encourage more people, more audiovisual filmmakers to make films about health issues. And we received 1,300 submissions from more than 110 countries. Thanks to all participants who expressed their interest to produce content about a great diversity of health topics and about so many initiatives at family, community, hospitals, and scientific levels. Here are some few indications, because I'm not here to reveal the winners, but about topics we'll tackle during this ceremony. Because we invite Facebook audience to ask questions. That's why I'm giving you here a few indications. For instance, we're going to speak in this ceremony about maternal health, midwives, nurses, sexual violence as well, neglected tropical diseases, non-communicable diseases, and these are only a few examples. So if you have questions on that, please go to Facebook and ask your questions. I mentioned nurses, and today is the International Nurses Day. We also have in our festival specific competition a category for the International Year of the Nurse and the Midwives. In the current pandemic situation, it became common to thank health workers every day. But when we launched this festival project last year, it was not the case everywhere. And at least for this reason, it's very good to have this ceremony today to thank all health workers and nurses again. And now to have more about these reasons for this ceremony, I would like to present to our jury to you. And we have some critically acclaimed artists in this jury. So from the music domain, we are pleased to have two famous singers, both received Grammy Awards. We have Angélique Kidjo from Benin and Ricky Cage from India. So just to start with, a quick introduction of each of them, and I will go to the other jurors later. I would like, Angélique, do you have 2 words to share with us about why it's important to you to have more films about health?
The thing that this pandemic is showing us that I have believed in my whole life is that our life has to be the priority of everything, at the center of everything we do. Health is not for sale. There are certain things that have to get out of this financial labeling. This pandemic is putting so much stress on our humanity, our ability to respond to pandemic. And this is just the beginning. And I hope we're gonna get prepared, we're gonna make decisions today to invest in health worker, in our hospital, in our health system, and also everything that comes from health. Mental health, violence against women, and malnutrition, everything. Because without us, human beings, there's no economy, there's no financial system.
Thanks a lot, Angélique. Thanks for this introduction. We have a very dense program in this ceremony, so I'm going to ask every juror to continue to present a few words on their motivation about filmmaking on health. We'll come back to every juror during the ceremony, of course, when they will have a chance to speak with the winners. So, Ricky Cage, are you connected with us at the moment, please? Do you have 2 words to share?
It's a huge honor for me to be part of the jury and part of anything that the WHO does. And films, music, and art are pretty much the best languages for communicating a message leading to positive social impact. So I'm very glad that the WHO recognizes this and is hosting this film festival.
Thank you, Ricky. Thank you so much. So I go on, and you will come back, Ricky, later in the show. We have, in addition to music domain, we of course have a juror from the documentary film making domain, Barbara Miller from Switzerland. Barbara, do you have 2 words to share with us for a short introduction, please? I don't know if Barbara is with us. It's quite challenging. I hear you, Barbara.
Yes, wonderful. Thank you so much for having me. I think it's a fantastic way to shed light on the life-saving work of our everyday heroes. So this festival is really wonderful that you're doing it. Thank you.
Okay, thank you, Barbara. Very thanks. I move on to Patrick Evenot from France, who is an international expert in animation film. Patrick, could you share two words with us about animation film and health?
Yes, I think that movie, TV programs, clips, video game, why not, are one of the best way to explain and promote health question.
Okay, thanks a lot, Patrick. And it's also my pleasure to inform you that we have also some jurors in this festival from the fiction movie domain, scriptwriter and director Richard Curtis from United Kingdom, and actor and director from Brazil, Wagner Moura, who both of them expressed that they were delighted to be part of this jury. Unfortunately, they are sorry that they cannot join this live. But Wagner sent to us a very nice message that we are going to listen later in the show. And here we have in the room, it's a big room, so they are far away to respect the prevention measures, of course. We have our 4 WHO experts who were the senior experts for this festival. Soumya Swaminathan, Elisabeth Hiro, Bente Mikkelsen, and Rüdiger Kresch. So you will, each of you, say a couple of words, please. Soumya, if you would like to start, please.
Thank you, Gilles. I think it's a wonderful way, films are a wonderful way to smuggle ideas into people's hearts and minds, much better than trying to teach people by giving lectures or writing articles. And I think that's one way in which we can spread the message of science much further.
I think, Charles, my words are actually impact and reality. I think the film scripts have definitely, for me, brings out the reality that's happening and also the impact on the people watching and the influence that has on the mindsets of individuals that are watching films. So those are my 2 words. Thank you.
So it's a true honor. This is really true partnership between art and life. And I think for people living with NCD, one of the world's biggest killers, the camera helps us to see and to learn and also to be compassionate. So this is the better way, I think, to really reach out to people.
Yeah, in health promotion, we know that health is created where people live, grow, love, work, and age. The films that we saw are very close to people. They tell their stories, and that's why we need more of those. Thank you.
Please go to this platform and ask your questions about their participation in this jury. So now I think it's really time to announce the winners. And we have here with us Dr. Tedros Ghebreyesus, WHO Director General, who strongly supported this festival project since its start last year. My deep thanks to you, Dr. Tedros, for your dedication towards this project and this tribute to all champions of health that we have now with this inaugural festival. So the floor is yours, Dr. Tedros, please announce the winners.
Thank you. Thank you, Jill. Good morning, good afternoon, and good evening. As you know, WHO is a science-based organization, but sometimes stories and films have the power to inspire and to change things in a way that science, evidence, science and evidence don't. To fulfill WHO's mission, it's clear to me that we need to use every tool at our disposal, including the arts. I'm delighted to be here today to announce the winners of WHO's inaugural Health for All Film Festival. And I would like to use this opportunity to thank my colleague, Gilles Ribou and Lorena Bernal for their initiative and for the incredible amount of work they have done to make the film festival a success. I encourage my colleagues, especially during the open hour we have every Thursday to talk to my staff, to bring crazy ideas that can change our organization, or to bring new ideas to change our WHO. And one of the crazy ideas or new ideas that I got was from Gilles. And when he told me, I didn't think twice. I said, okay, go for it. And that's why we're here together, because of Gilles and his idea. And as I said earlier, although our organization is a science-based organization, telling our stories through art is very, very important. And that's why Gilles suggested this. And please, Gilles, accept my greatest respect and appreciation for being the pathfinder of film festival and telling our stories through film in our organization. That I promise we will sustain. The quality and quantity of films submitted surpassed all our expectations. We hoped for 500 submissions. In the end, almost 1,300 films were submitted from 110 countries. Like all good films, the submissions we received are both heartwarming and heartbreaking, uplifting and sobering. Before I announce the prize winners, I first want to give 3 special mentions from the jury. First, a special mention in the video reports category is for a film called Cassandra, a 13-year-old mom, which was produced by NTN24. It was directed by Gustavo Algret from Spain, with cinematography direction by Martin Sevino of Uruguay. Muchas gracias. And second, special mention in the nurses and midwives category is for Nursing in the Community, a film produced by Health Education England and the Queen's Nursing Institute, directed by Charlie Inman from the United Kingdom. Thank you. And the third special mention in the NCDs category goes to Cancer Divided by Matthew Corollis and Carter Smith from About That Media, a production company based in Canada. Thanks again. And now, on to the winners. In the non-communicable diseases category, the winner is Living Without Limits, a film about living with diabetes type 1 in Mexico, made by BBC Storyworks for the Helmsley Charitable Trust. Congratulations. In the student category, huge congratulations to the winner, Nitai Steinberg, a biologist from Israel, who made the film Antibiotic Resistance, about the rising threat of antimicrobial resistance. May I say shalom? In the Grand Prix prize category, there was an amazing response and 3 winners. In the nurses and midwives group, the winner is War and Grace by Sonia Lohman from International Medical Corps. In the video reports category, congratulations to A Doctor's Dream, which was produced by the Drugs for the Neglected Diseases Initiative with Scholars and Gentlemen, a production company from South Africa. Congratulations. In the animation films group, the victor is Limbo by So Ehdo Po, Nanwin May I, and Waezar Che So from Myanmar. Congratulations to the winners and to everyone who submitted a film. Thank you for your enthusiasm, creativity, and hard work. And thank you for your commitment to drawing attention to these pressing issues in global health. Before I end, I would like to thank our juries. My sister Angélique Kidjo from Benin, merci beaucoup. And Ricky Cage from India, namaste. And Barbara Miller from Switzerland. And Patrick Ivano, I missed the country. France, merci beaucoup.
And Switzerland.
And we have also from my colleagues, the jurors, I would like to thank Somia, Elizabeth, Bente, and Ruriga. So thank you so much to our jurors. I know you have worked very hard, and thank you so much for your commitment. Look forward to continuing working with you and to your support. So again, I would like to end with the wonderful Gilles, who brought us together, and merci beaucoup, and really appreciate, but you are not alone. I would like to thank Lorena also, and thank you so much again. So back to you, Gilles.
Thank you. Merci beaucoup, Dr. Tedros. Effectivement, sorry, I should speak English, not French. I'm missing my mind now. Okay, so congratulations to all these winners. Thank you, Dr. Tedros, for announcing this wonderful list. And since you mentioned this thanks to me and Lorena, I would like also to highlight quickly that this has been a big momentum in WHO staff to prepare this festival and this ceremony. We have had hundreds of colleagues helping us at different phases of the project. And we have also received, and I will thank them at the end, the support of many other organizations and institutions. But let's stick on the winners that you announced now. So indeed, as you mentioned, just to give a precision for those who don't know, we had initially we had three categories: nurses and midwives, to pay tribute to the International Year of the Nurse and Midwife, video reports, and animation films. As you noticed, Dr. Tedros announced as well a special prize for a film on non-communicable diseases. It's difficult to pronounce this one. And we will have probably in the coming months additional special prizes, because in fact we received so many submissions and with so good quality that many technical departments in WHO and regional offices in different parts of the world are now interested to also pay attention to all this filmmaking and these different proposals. So let's not take more time on that. Thank you. We go now for the first Grand Prix that Dr. Tedros announced. I say the first, it's the three Grand Prix have the same value, but I say the first because it's the one on nurses and midwives, and it's the year of the nurse and midwife and the International Day of the Nurses. So you mentioned, Dr. Tedros, War and Grace, a film by Sonia Lohman from International Medical Corps. Sonia, you will have a word to say in a minute, but first we are going to show a short excerpt of your film. I'm sorry for everybody, this will be frustrating. I am frustrated to show that, but let's show 40 seconds. Let's watch them now. Sonia, you will have the floor, but first I will give you a question. You came on from Philip from Canada, a question about, which came on Facebook audience, about you documented the plight of midwives in South Sudan, in a war zone. While making this film, what did you learn, is asking Philip, yourself about challenges for women, especially regarding maternal health in a war zone. So Sonia, I don't know if you are connected with us and if you heard the question from Philip.
Yes, I heard. Thank you for the question.
So.
Okay. Yeah, well, South Sudan was a really challenging place to be, for sure. It was actually my first time to the field and my first time to Africa, and it was frankly extremely heartbreaking to see the lives of women in this country. It has the highest maternal mortality in the world. I think it shares it with Afghanistan. Women, you know, give birth in really horrific conditions often, and most often in the absence of a qualified health worker. So they're, you know, left on their own to give birth, and many times will die in childbirth. So it was really, really, really heartbreaking to see these circumstances, to witness this. But at the same time, as the film shows, you know, there is midwife training happening, and this is really the highest hope for these women. The story of Grace and her students are really reaching out into these communities where women would not have anybody there to help them to give birth and to live through this experience of childbirth. So.
Okay, Sonia. Yes, I wanted to give the floor also to two jurors who participated in this team about nurses and midwives, Ricky Cage and Barbara Miller. Ricky, would you have a question to Sonia or a remark to say about her film? And then I will ask Barbara to say a question or a comment as well. Ricky, are you with us?
Yeah. So I think it was a fantastic movie, and I mean that it was pretty much a no-brainer for me that this really had to be recognized. So congratulations on making such a brilliant, impactful movie.
Thank you so much.
Do you have a question or a comment on, as member of this jury team as well? I see you, Barbara, but I don't hear.
Yeah.
We have a bit of a small delay, I think.
Yeah. Do you hear me now or not?
Yes, please. Good.
Yeah. Congratulations, Sonia. It was such a moving and incredibly well done documentary. And I mean, now hearing from you that it was the first time for you being in the field, it's incredible how respectful, how graceful, how with a deep impact you have done this movie, and very, very nicely filmed. And yeah, I think it's really a wonderful work you have done here. Thanks so much for doing your work.
Thank you.
Okay, thank you. So I would like to say we are going to have some specific Facebook Lives in the coming weeks. We propose if our winners and some WHO experts will be available to have more discussions about these important topics. We have so many winners, as Dr. Tedros announced, and a very dense program. So now I would like that we take a bit of time with Elisabeth Hiro to speak about the special mention which was given to nursing in the community, a film produced by a filmmaker from UK, United Kingdom. Elisabeth, do you have some comments on this special mention?
Yes, I think we were very impressed also with this film, Nursing in the Community, and felt we needed to give it a special mention. It was very well produced and it's scripted. The film was very powerful images and narrative between community nurses and patients in the community. It was very emotional, at the same time well blended, to highlight the important work and why community nursing is an exciting career option. You just felt it was a very well produced film to highlight those elements.
Thank you very much. Thanks a lot. So now we are going to move to the next category. But before we want this ceremony to be also entertaining. And since we have two singers, those who were connected just before the start, you heard already Angélique Kidjo singing a song, and we will play it again. But now we have also received from Ricky a very nice music participation. So Ricky, do you have a word to say about this piece of music you're sharing with us today?
Yeah. So basically, this is a song about solidarity and kindness, and the virus does not discriminate, and we are all in this together, as we all know. And our simple acts of kindness to each other can inspire millions and even save millions. So that's what this song is all about. It's called "Shine Your Light."
Remind us, like a simple act of kindness. Hey, and in the blackest of night, just one flash of light shows we're not alone. No, not today. It is time. Let's do this. It's our time. Let's do this. It is time to shine your light. Let's do this. It is time to shine your light.
For this great song, which is quite symbolic of our festival project as well, because with all these people singing with you in this clip, it reminds me like all the filmmakers who participated in the festival. It's kind of symbol I see there. So now let's move to the Grand Prix for the video reports category. As you heard from Dr. Tedros, A Doctor's Dream, produced by DNDi, research consortium. And we have, before we look at an excerpt of this film, I invite again the participants on Facebook to ask their questions. So we can take your questions about the festival, the filmmaking process, and the different films which were announced by Dr. Tedros as winners. So let's watch now an excerpt of this film, Doctor's Dream.
Le cauchemar de tout docteur, c'est de tuer son patient.
These excerpts are very frustrating. I told you we have to go very quickly, and we would love to see the films in full, but you will have a chance to do so at the end of the ceremony. We'll have on YouTube a specific live with all the winning films in full, and this will remain online on YouTube for long time, so you will have a chance to watch them this evening or later in the coming days or weeks. So we have a question about that from somebody who, just let me check right now. Yes, Sayo from Japan mentioning, yeah, this is a complex scientific topic, research on a drug for sleeping sickness. So our winner, we have somebody here from DNDi. Would you please tell us how you approach this complex story about research for a drug on sleeping sickness and to make it a compelling story with a doctor's dream, please?
Sure. Hello, everybody. Thank you. Allow me, first of all, to say how excited we are to receive this prize. So I just want to thank my comms team, my partner in crime, Ilan Moss, the sleeping sickness team at DNDi, the Kinshasa office, who I know are watching, and the fabulous crew in South Africa, scholars and gentlemen. So thank you very much to the jury, to Dr. Tedros, the WHO, and the organizers of the festival for the recognition and also the opportunity to shine a light on neglected patients and the healthcare workers that dedicate their lives to them. In answer to the question, I think, yes, it's definitely a complicated topic, and drug development also is a complicated topic. And so what we did is very much focus on storytelling and human emotions. So we tried to distill the complicated science and the complicated epidemiology and get rid of that and really focus down on one man, his dreams, his fears, his hopes, his nightmares, and to tell the story through that lens. And I think it's quite complex to do in 7 minutes, but that's thanks to Scholar's fantastic cinematography, and through that, the strength of the character that is Dr. Kande and his story, we were able to sort of portray those emotions and take a viewer who wasn't familiar with the story on a journey with us. So I think that's the way to do it, is to focus very much on the emotion.
Thank you very much, James. Maybe Soumya Swaminathan, you were in this jury team. If you would like to have a comment on this film or the scientific research associated to this particular topic on neglected tropical diseases, or a question to James, up to you.
Thank you, Gilles. I think, first of all, again, congratulations to the producers and the director of this film. I think what struck me really was that as a medical doctor, I know about these diseases. I've read about sleeping sickness, know what causes it, what's the parasite, what insect spreads it, and so on. But what watching the film does is it really brings the emotional side, which is much more impactful. Just seeing the girl that we saw in that clip just now, affected by sleeping sickness, who was sort of swaying and dancing and not really in control of herself, and how she changes after this new treatments for sleeping sickness are developed, and she's treated with them, and she starts living a normal life. And so this organization that sponsored the film, DNDi, obviously focuses on neglected diseases, which most of us don't think about very often, because not only are they're not all rare, some of them are rare, but they all occur in populations that are generally neglected and invisible. The other thing I must say, that serving on the jury with Richard Curtis and Wagner Moura was an incredible honor and a privilege. Two such well-known and well-respected directors and actors. In fact, my family and friends were very jealous that I got to spend a couple of hours with them discussing these films. And I must say that it was a tight competition. I think all the films in this category were very, very good, including the one that received the special mention. And we had a lot of discussion and debate about which one should be the winner, because each of them had a clear message, were compelling, were emotionally also very, very compelling. And so I really enjoyed being on the jury, and congratulations again to everyone who was associated with this winning film, but also with all the others that made it to the shortlist. Thank you.
Thanks a lot, Soumya. So let's move on for the next special mention from the jury. This jury that Soumya just presented with Wagner Moura, Richard Curtis, and herself, they decided, as Dr. Tedros said, that Cassandra, a 13-year-old mom, a film produced by Gusto Alegre from Spain and Martin Cervinho from Uruguay should be mentioned with a special mention. So here I'm going to just to give you a short feedback from this jury. It's a film which tells about a teenage pregnancy in Costa Rica. And the jury admire the sympathetic approach to a complicated issue that the film presents. The way it brought different topics and moves the audience with it. Data, politics, sex education, violence, advertising, child marriage, all these aspects are part of the film. And in the large context of Latin America, Wagner Moura said, Cassandra is a very charismatic character. Her story is a very strong reality in the favelas of Brazil. I was fascinated by this girl with a mother and a kid at the same time. And as I said in the introduction, Wagner also sent to us a very nice message about his participation in this jury. So now let's listen to the message from Wagner, please.
I want to thank you guys for the opportunity to have participated of the whole film festival as a juror. This is a very difficult, obviously a very complicated moment, very difficult moment of our history. And in a moment like this, the importance of the World Health Organization, the importance of the UN, the importance of all organizations in the world that are trying to provide information and they are trying to mitigate the suffering of the most vulnerable ones affected by this crisis in the world is even bigger than before. Therefore, it was truly an honor for me to participate. The films that I have seen educated me a lot about different health issues around the world, and I want to thank you guys for this opportunity. I hope many other people in the world that they can watch these movies that you guys made. I want to congratulate all the filmmakers that participated of the festival, especially the winners, and I want to encourage you guys to keep doing these films, to keep talking about your communities, to keep exposing the vulnerabilities of the communities that you guys filmed, and to keep, this is the perfect moment to praise the work of volunteers, of doctors, of health sector workers that have sacrificed their lives for the sake of the most vulnerable ones. Thank you very much for the opportunity. Good luck, and I wish you the best. Thank you.
So we thank Wagner Moura for his participation, for his kind message here, and of course Richard Curtis, who was part of his jury team and who also sent to us his pleasure to have participated in this project. So we have to move to the next Grand Prix in our next category. I don't know if you noticed this trophy that we have here, and Dr. Tedros has the same one. This is going to be given to our winners when we can meet them after the lockdown period. So we are going to have our evenings of a festival by the end of October in Geneva, and we all hope here that our winners will be able to travel and to receive their trophies here. So for the Grand Prix for animation films category, Limbo, a film called Limbo, from students from Myanmar who made their film with a school based in Germany and Myanmar, the Yangon Film School, and we will speak with one of the students, the tutor, and the school producer in a minute, but not in a minute, in 30 seconds. In fact, we are going to have a quick look at the, let's watch the excerpt from Limbo now.
တကားထပ်ဖွင့်ရပြင်းနေဆိုတော့စကားစီယုံမစီထားတာအဲ့မတက်လာလည်းမသိဘူးကိုအပေါ်မှာသူရောက်တဲ့အချိန်မှာမှကိုကတည်တယ်တော့ကျွန်တော်လက်ကိုတစ်ဖက်ကဝမ်းလိမ့်လာပြီးတော့ဘက်ကအုပ်ထားဒါကနေမှကျွန်တော်ဆော်ဟာဒါပြောတယ်တိတ်နေတယ်တိတ်မနေဘူးဆိုရင်တဲ့နင့်ကိုတတ်မယ်တဲ့
So see the film in full, but as I said, you will have all of them on YouTube at the end of this ceremony in full. So we have with us the producer from the school. Maybe if you'd like to say a few words, Lindsay Marison, are you with us? And then we will switch to your student in Myanmar to tell more about the story he told, a strong story about sexual violence during also a war period, a conflict period. So do we have Lindsay Marison online? Yes, I see. Do you hear me?
Yes, I do.
Okay, please. Do you have a few words to say about your production process for this film? How you work very quickly with the students in Myanmar to decide on the topic and to decide on the animation film technique you used?
Well, I'd first like to say thank you very much to the WHO for this amazing award. We're absolutely thrilled and very surprised. It's a sheer delight to be awarded this prize, and a great fillip to all the filmmakers that we are training at Yangon Film School. This film was one of 3 films we made in a series of films about gender-based violence against women in areas affected by conflict. This is part of the nexus of precarity and human rights and abuses in the country, and it was a conscious decision to meld documentary with animation because we thought it would be a way of protecting the documentary protagonists and also allowing us to work at the interface between art and development. So allowing the students to create, to allow their imaginations to run wild, to create a safe place for the protagonists to talk about what had happened to them, but also to reimagine these events in animation.
Thank you very much, Lindsay. I would like to give, to complement what you explained, now to ask Angélique Kidjo and Patrick Evenot were both in this jury team for animation films. So, Angélique, would you have a question to ask to the student, one of the students, the 3 students who made these films? Are you with us, Angélique?
Yes, I am here.
Okay.
I would like, first of all, to say congratulations for the courage of doing such a beautiful documentary about rape. It's done so elegantly and protect the identity of the girl. I don't have a question. I just want to encourage more people to talk about those issues of rape of young girl. We were talking about another documentary, a 13-year-old mother. Our teenagers are not supposed to be raped, not being mothers, not being wives. They have to go to school. And that's my fight. And I'm realizing that the fight I'm having in Africa is pretty much everywhere. I never thought I would hear this from Costa Rica or from Myanmar, what the young girls are going through. And I think I want to give a big congratulations to WHO, because we need this message to be heard for the policy in countries to change, for the leaders to put a policy in place to protect the vulnerable people. And there's no society, there's nothing if we can't protect our children. It breaks my heart every time I hear this, every time I witness this as a UNICEF Goodwill Ambassador. I just ask myself the question, why we are silent? Why are we powerless? Why can't we do something about it? What is holding us back for us to protect our children?
Thanks a lot, Angélique, for these strong words. And I would like to have a reaction from our students in Myanmar who made this film. So there were 3 students. We have one able to join, I hope, connected right now. Difficult for me to pronounce your name, I'm sorry. So, Dopo, should I say? Are you online with us?
Yes.
Okay, nice to see you. So what would be your reaction now as a of this animation film and about the topic you chose in Myanmar? Can you tell us about this? Why did you choose this sexual violence story based on a true, real testimony?
Yeah. First, I want to thank you, Angelique, and thank you for empowering the girls from our country, because this topic is like a taboo in our country, and we can't talk about it, and actually honestly, I don't want to this is I don't care if it is about rape or something other else. I just want to do the animation. But my school give a chance to do about this topic, and it is animation. I just want to do the animation. So my motivation is it was first like that. I just want to do that. I just want to do the animation. So but this this story it was in my region, this story happened in my part of the country, and it happened a lot.
Okay, thank you. I'm sorry. We have to move on since you are three persons. Many thank you for your testimony. One of your teacher you spoke about animation. You were motivated to do animation. So we have Patrick Evenot in our jury, who is an expert in this domain, of course. Patrick, would you have a question to ask to the teacher of this student we just listened to from Myanmar? We have a teacher online, and you have a question or a remark to make about this animation film.
First, congratulations for the strong story. It's very impressed. I'm very impressed also by the choice of the technique. It's not easy to make animation with this technique, and it's not in the school. Normally, we work on 3D or 2D animation. It was very special choice, and congratulations for that, because it's really the good technical for this story.
Okay, so do we have the teacher of this for this prize, the teacher of the Yangon Film School?
Debjani.
Okay.
Debjani.
We wait. We have. I hear a sound. I hear somebody try to. Okay, here you are. We see you. Can we hear you now?
Yeah. So I would also like to mention that this film was made in just 2.5 months, and none of the students had any prior experience to make animation or even films. So I would like to congratulate them, and this is fantastic. Thank you for the award. That they worked so hard to make this possible. They worked really long hours. This was a challenge, actually, that they didn't have any experience in animation, but it also was an advantage because they were so keen to learn the new medium. So yes, thank you.
Thanks a lot for your words. So I'm going to move on with our next, not a winner, but a special mention as well from... Sorry, no, we don't have a special mention in animation film category. I'm wrong. I'm going to go for the student prize. So this is the film Antibiotic Resistance by Nitei Steinberg. And we have, before we go to you, Nitei, online, we have an excerpt of your film to watch as well. So let's watch this excerpt from Antibiotic Resistance.
We tend to think about ourselves as humans, but this is only partly true. We are composed of trillions of human cells. but we are also made up of trillions of bacteria. These bacteria are part of us. They cover our entire skin and guts. Bacteria help us digest the food that we eat.
Thanks for this to my colleagues who are helping us in this ceremony organization and logistics. We have a question from the audience. Nite, the question is, you mixed different technologies in this film, animation, 3D modeling, real filming, characters filmed. Can you tell us more about the challenges of making this film? And especially, I think initially you were not a filmmaker, you were a biologist, and you studied communication and audiovisual making. So, Nite, if you would like to tell us, and then after that we'll have Rüdiger, who will also dialogue with you and give his feedback.
Hello, can you hear me?
Yes, thank you.
Yeah, okay, great. Thank you very much. Yeah, first of all, I'm very honored to be part in this event and be with creators from all around the world. And yeah, thank you for organizing this. Yeah, so this question actually is connected to the thanks that I wanted to give to the program where I studied, the Biomedical Communications program at the University of Toronto. That they teach specifically how to communicate complex scientific topics to the broad audience. So I would like to thank the advisory committee, Dr. Jody Jengrichson, Michael Coren, and Dr. Gail McGill for making this project possible. Yeah, so the challenge of making this animation again, with all the instructions that I get, all the support that I got from the professors of the program, it was very manageable. It was, yeah, I really enjoyed working on it and developing the concept and also the technical challenges. Yep, so this is my answer, and I would like to thank also my family and my partner that they couldn't do anything without their support.
Thank you, Nite, for these words. Rüdiger Kresch, you were in this jury team also with Angélique Kidjo and Patrick Evenot. I have to give, before you speak, Rüdiger, a precision. In fact, the student prize is out of the 3 categories. But we had more submissions from students in the animation films category. That's why this jury team ended to decide on the student prize. So Rüdiger, please.
Yeah, you take a complex public health issue, antimicrobial resistance, and then you break it down, you break down this complexity, and then you spice it up and make it inspiring. You tell the AMR story so that we as watchers want to see more. Nitai Steinberg, you've really inspired us, and the film was really intriguing to us. And we felt that this can only be done by somebody who knows both the science and the filmmaking. And it happens that you actually are a biologist, and then you went into filmmaking. Was that the reason to tell more of these scientific films and to tell us more about public health issues? Over to you, Nitai.
Yes, I think in general, yes, my passion to science and to spread it to everyone and spread the knowledge, it was always my passion, and that's why I chose to shift my career into biomedical communications and go to study at the University of Toronto. So, yeah, I think in general we see it now that it's really important that people understand the theory, the scientific theory behind diseases and behind health policies. Without this knowledge, without this understanding, it's really hard to expect anyone to cooperate with any type of instructions. And sometimes, the effort to make this concept accessible to everyone is really important. And I think, I'm very glad that I could take part in it, and that's what the WHO tries to do all the time. So, so it was indeed my passion to try and communicate science to everyone, because we see the implication of it in everyday life right now.
Thanks a lot to both of you. So now we are going to move to our next prize, which is not a Grand Prix. It's, as I mentioned earlier, in the specific category which was created afterwards for a specific thematic approach, like the non-communicable diseases, NCDs in short. And this NCDs Film Prize, as Dr. Tedros said, is going to Living Without Limits, a film about diabetes type 1 in Mexico. And we'll have our juror to speak about that, Bente Mikkelsen. But first and of course we have two representatives of the film making crew. But we go again for an excerpt, a short excerpt, as we did for the other ones. So please, could we watch now 35 seconds of this film from Mexico, about Mexico, please.
América tiene diabetes desde el año con 7 meses. Fue diagnosticada con 598 de azúcar en un chequeo rápido de glucosa, porque acudimos de emergencia a un médico particular y de ahí fue trasladada en ambulancia a centro médico, un hospital de 3er nivel.
It's always frustrating, as I told you earlier. So please go to the full program, which will be aired at the end of this ceremony. So we have a question from the audience here to you, Gemma Jennings and Pam Manga from BBC Storyworks, who made this film for the consortium. What's the name? You will mention that to us. I don't have that in my notes. So the question is, how did you manage to interview kids and make them speak about their health condition? So, what's your reaction? Maybe Gemma Jennings, would you like to speak first?
Yes, absolutely. Well, first of all, thank you to the judges and to the World Health Organization for this inaugural award. It is a real honor to accept on behalf of everyone that we collaborated with to bring this story to life. In answer to your question, I think from the outset, we were adamant that we wanted to hear from young people affected by non-communicable diseases and to give them a voice. And we really wanted to shine a light on the subject of non-communicable diseases, and in particular to challenge some of the misconceptions surrounding type 1 diabetes and the stigma associated with the condition. And I think ultimately finding those memorable and interesting characters, you saw one of them there, America, the young girl who practices injecting her teddy bears with insulin. Later in the film, we also meet Alexis, who is an inspirational young man that his whole life has been changed by his condition. But actually, what is inspiring about them is their honesty and their openness and their joy and their warmth as well.
My microphone, thanks a lot. So yes, we have with us Bente Mikkelsen, who is part of this jury team for NCD's Film Prize. So Bente, you're here in the room. Do you have a comment on this prize or a question to Gemma? And Gemma is joined as well by Pam Mangat, the senior producer who is involved in this film. So maybe Pam will answer your question.
So first of all, Gemma and the team, I mean, to have such moving voices as we can see in this film from Alexis and Americas, I think we can write 10,000 pages. It will not make the same difference. And what I particularly liked was also the way you show that governments really can and must, I would say, support these people living with diabetes, which is a huge part of the non-communicable diseases, which is also, of course, about cancer and heart and lung diseases, but this time it was diabetes. So I was very, very touched, and I think my question is a little bit in the same line as Jill's. So how did you convince the families to be part of this? What was their main motivation to be part of the movie?
Sure. So I would just like to say that this film would not have been possible without the Helmsley Charitable Trust, who support projects like Life for a Child, and without the team at the Mexican Diabetes Association. So all of those people have really supported us, and the work that these organisations do in collaboration with the government to support children and families living with type 1 diabetes is really important. And we're delighted to announce that the prize money awarded by the WHO will be donated to the Mexican Diabetes Association to continue the important work shown in the film. I'm joined by our wonderful producer, Pam Manga, and I know that Pam wanted to say a few words about how we worked with the families in their own homes.
Yes, I was going to say, in order for this to work, obviously we needed sort of buy-in from America and Alexa's family, and from both of them, and they were both really courageous, and we owe them sort of a huge thanks. In terms of why the families wanted to speak, is that they had so much help from Life for a Child, and they were indebted to them for the education they got about diabetes, but also the stigma associated in Mexico with type 1 diabetes. If you watch the film, America's mum goes on to sort of say that people said to her, what have you done to your child? How did you do it? Did you give her too much sugar? So it was also, they wanted to make sure that they provided an education as well, that there are so many myths associated with type 1 diabetes. So for that reason, both families were really keen to speak to us. And also, the children were as well, to sort of hear it from their voice, which was so important. I think that was key in terms of telling the story, is to do it from their lens. But also, I just want to say thank you to everyone involved on the team, the production team, who worked so hard to make it work. Andre Breton, our director, Nikki Omar, our executive producer, Simon Shelley, and the wider BBC Storyworks team, and of course, the Helmsley Charitable Trust.
Thank you very much, Pam. Thanks also to Gemma for your words. And again, as I mentioned, we will organize more live shows with specific winners, so that we could go more in depth in all those discussions on different topics. Now we have a special mention, Bente, that you will comment. Cancer Divided was also attributed, not a prize, but a special mention. Would you like to say a few words about this film, please?
Yes, I think, we want everybody to win here, because all the films were so fabulous. But I think what I would specifically mention in this film is maybe something that is still a big surprise for many, that all the NCDs are overrepresented in the low-income countries. And it's all about inequity, unfortunately, and also stigma. And I think this film, you cannot see it without really taking to tears, because it really shows better than we can explain this situation. And I just want to mention that I think this is a WHO prize, and I think we can be proud of WHO also in this picture as one of the partners to solve these things by providing the research to tell people and help the countries how to really support the healthcare system, the patients, and also partner, and be able to monitor and, I think, pinpoint. So thank you very much. This was a huge inspiration for my work.
Thanks a lot, Bente, for these words. So now, before we are going to conclude soon this ceremony, we are going to have Angélique Kidjo again. She shared with us a song that she made also as a goodwill ambassador for UNICEF. As you know, most of our jurors from the artistic domain, like Wagner Moura, Richard Curtis, Ricky Cage, Angélique Kidjo, are engaged in UN activities, supporting UN activities or humanitarian actions and social sustainable development and social actions. So, Angélique, let's listen to your clip that you sang from home. Could we listen to that clip?
It's a time to sit it out.
feel, which we shouldn't do. Everybody can help fight COVID-19 by doing what we need to do. It's the time to sit it out. Stay at home and wait it out. This is what we gotta do, mama. Hey, this is what we gotta do, papa. We need to keep our hands clean. Don't touch your face, keep your distance, please. Groove along and dance with us, mama. Let's come together, sing this, papa. In this time of coronavirus, it's no touch time. The virus can be beaten by us, and soon the coast will be clear again.
Okay, thank you. I think we are going to end with Angelique with this clip from home. Thank you again, Angelique, for sharing that with us and for this ceremony. So we are going to conclude now. Many thanks for your attention. I will give the floor to Dr. Tedros for a few words of conclusions, and then I give you a few final information at the end.
Thank you. First of all, my appreciation to Angelique and Ricky. Not only they served as jurors, but for their music today. So Angelique, merci beaucoup. And Ricky, namaste. Thank you so much indeed. And you gave color to our program today. It was the first one. And because of your commitment and support, we can see how this thing could be helping science in passing our message, in telling stories to people. Then to those to the winners, congratulations. And to those who have joined us online, thank you so much for joining. And starting from Gilles, I would like to thank all the colleagues from Communications Department, starting from their head, Gabi, for the job well done. So thank you so much again from us. And until we have another round next year, the second edition, bye from us. And Gilles.
So, Dr. Tedros, you are announcing another edition next year. Exactly. That's a kind of scoop. I didn't know that. So, we have more job on our plate. And I would like to, speaking of a job on the plate, I would like to really thank a lot of people. As I mentioned earlier, we have a lot of colleagues who participated in all the regional offices of WHO around the world and in Geneva, of course. And also, we had a lot of support from, for instance, the Annecy International Film Festival, the International Council of Nurses, the International Confederation of Midwives, the NCD's Alliance, and many other institutions also supported our call for films. They supported the organization of this, the promotion of this award ceremony, and so on. And even for this year festival, Dr. Tedros, it's not finished because we'll have probably certainly a special prize on mental health, a film special selection to be made in the coming months. We're going to have more Facebook Live. So really quite a good dynamism around this project. And personally, I would like to say that I hope this project is really going to encourage more and more filmmakers to speak and to produce good stories, compelling stories about health. And when I say filmmakers, this festival has been open to good amateurs, and professional. It's kind of challenge to mix both, but we succeeded to have very good proposals from both sides of the production approaches. And yes, more and more people in communities can make films nowadays. It's easy to make a film with a technology and to distribute it. And we hope this festival will contribute to encourage people to do good quality films. So thank you to everybody again. Thank you to the audience, to all of you who listened to this ceremony. We are going to have, it's open to questions from journalists as well. So Margaret Harris will be available from our team to follow up with journalists. For now, we close the white ceremony audience. Thank you very much again. And thanks to all for your presence here and all the persons online. Thank you.